There's been a few people who have sent me messages and discussed about the therapist who got killed by one of her patients, and I'd like to take some time to talk about protective measures that therapists should be taking. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. And I've been counseling people for many years now, and I've worked with some pretty dangerous environments, pretty dangerous people overall. Anywhere from corrections to psych emergency, things where I've had to like restrain people and talk people down. And luckily, knock on wood, my career has never, I've never been injured through my career. And so I just want to pass down some safety tips that I've learned over the years, um, you know, and and I share with other therapists. I have a lot of therapists who watch. I think number one is no one should ever be allowed to just walk into your office where you're counseling patients. So people may be able to walk into a waiting room and like wait, but they shouldn't be able to come back behind somewhere and get access to you right when they want it. If you go to any medical, most of the time, I won't say all the time, but most of the time, in any medical doctor's office, you can't just walk to your medical doctor's exam room. Usually, you have to go past some people to get through it. There's usually a locked door from the waiting room to the back to where patients are seen. So I think that's number one. And now in my office that I go to now, it's even more secure in that way. Like we have security sitting down at the front desk. There's an elevator you have to take to get to my office, but that elevator doesn't move until security puts their keys into it. And then, once people get up to it, we still have front desk staff in the place where I'm at. So there's a lot of different things that people have to go through. Plus, there's cameras and things like that everywhere. You need to invest in a level of security and safety in your office. If you're in private practice, always, 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 I can't say this enough, spend the extra money. I know a lot of people don't want to do that, but it's worth it to spend the extra money to make sure you are secure. Two, your office setup is needs to be very strategic. As a therapist, I've always sat closest to the door. And any therapist is working with any mental health clientele, regardless of if they're violent or non-violent. Therapist always needs to be the first person, the closest to the door, and the first person to be able to access the door. How that door opens is also needs to be very strategic as well. So you want to make sure that your door isn't one that blocks you from being able to get in or out of your office very easily. Number three, you need to recognize when your clients are decompensating or they're escalating, and you need to take the steps to do what you need to do right then and there. So what I mean by that is if your clients start to spiral, and a lot, sometimes I've always been able to catch my clients when they're spiraling, even if they're spiraling a little bit, and we nip that in the bud right then and there. And I don't do it too much anymore, but I have done it to where I will admit someone to the hospital right away. I will say, hey, we're going to get somebody to come pick you up, an ambulance to come pick you up. And because I'm concerned about you and I want you to be admitted, and I will call the charge nurse on duty to have a patient admitted right then and there, and I'll tell them what's going on, because confidentiality is over, and I'm going to say this is what I want, and then I'll let my patient know that, hey, we're going to call somebody, a family member or whatever. And there's a lot of patients that whenever you say that, they don't want to do it, or they want to, all of a sudden they're straightening up. No, we're not doing that anymore, and I'm making the decision to go ahead and hospitalize you. And this is what we're going to do. I have to take charge, and I'm not necessarily, sometimes you can try to get a person's buy-in, but my decision doesn't rest on getting buy-in from the patient. Ideally you want to have it, but it's not necessary for me to make a clinical decision to protect your safety and well-being. I also have training in the criteria that it takes to admit, what it takes to admit a person to the hospital and things like that, and what hospitals will need to see. But that comes from years of being able to work and do that. But always take that stuff seriously. The next thing is, I don't know that I've ever, when I've been in private practice, I don't know that I've ever had an office alone. So normally the way I've done it is I've always been in a suite. So there's usually almost always somebody there, and I'm not usually there working alone. So there's usually another clinician, or it's usually busy and we're all practicing during the day. So I would encourage that you have suite mates that you're talking to, that you're engaged with, and that you guys are, roughly practicing around the same time. You you do take more of a risk when you're in the office by yourself. Only counsel clients that are within your scope of practice. If you have a client and you feel like their clinical issues exceed what you're used to, or you're just not comfortable, or this is going a different direction, refer out to someone that's more skilled and competent in that area, and just refer out. And the sooner you move on, the faster that person can get the help that they need, and it can actually be more of a beneficial relationship. But a lot of times what I found, unfortunately, with people is that they will keep clients, for the fact that they may want to make money or they may need the money, but they will keep clients that are beyond their scope of practice without getting consultation. That's the other thing that you ought to be doing is if you're in practice, private practice, you should always be consulting with somebody at least once a week, even if you're a skilled, clinician, like if you have problems or you're not well versed or you have questions about it, consult. Even myself, at times when I have questions or concerns or I don't know, I still consult. Sometimes I'll consult psychiatry. I'll consult another. I don't really consult too many therapists anymore, but another psychologist. Things like that. I will still consult if there's things that I am not sure on, or that I feel like I have some questions, or what would you do? Make sure you have good doors in your practice too. So you want to have very strong doors. You don't want something that someone could just lightly push open or kick open and your whole infrastructure is compromised. You want heavy, heavy doors and things like that. You also need to be able to be confident enough to take direction, and tell people you need to leave, or you need to wait for me in the waiting room and I'll be with you in just a second. I can't meet with you. And again, I don't know what happened with this woman, but taking confidence, you take confidence and you take control. And that also may look like, okay, well, I need to, just wait in the waiting room and I'll have someone come up for you, or calling the police as well to, when you say, hey, I'll wait in the waiting room, just having the police come and say that you're afraid and don't go back out until, authorities are there. At the stage where I'm at in my career now, whenever I've had patients who get smart with me or they get out of pocket, it's an automatic refer out. Or if there's a threatening hostility, menacingness to their tone, anything where I feel uncomfortable, I'm not able to handle it, is an automatic refer out. But if they threaten me, I'm not required to give referrals. I just say, I'm not going to see you anymore. And that's not something that's actually really happened to me in private practice, more so in the correctional setting. But I think those are just some tips of safety. And again, she could have done all those things. I don't know her, and I don't know a whole lot about her case. But usually, in my experience with people who get hurt, they don't have a lot of these safety measures in place, or they don't call out behavior right when it starts. Hope that helps. Thanks so much.